Senator Braun.
Thank you, Mr. Chairman. In my home state of Indiana, we have the third highest maternal mortality rate at 44 deaths per 100,000 births, 22. That's sad. Regarding this sad state of affairs, local news article said that nothing has changed in 10 years. That needs to change. That lack of improvement is disappointing state by state. That's why I've been vocal on healthcare in general here. And we did pass out of this committee the PREMIE Act reauthorization, which renews resources for HHS to promote healthy pregnancies. The Improving Access to Maternal Health for Military and Dependent Moms Act, that is being reviewed. Hopefully we get that through this committee. And the Standing with Moms Act, which would increase the availability of pregnancy-related resources to expectant mothers, another bill. So we're drawing attention to it. My question is for Dr. Lawson. In your home state of Texas, what have you seen there? Have they been improving? There's a lot more agility at the state level to address things. Tell me what's been happening there.
Thank you for the question. Up until 2021, we have not improved. Some new data, I know that our MMRC is working on the biennial report. We'll hopefully have that this summer to see where we are for 2022 and thus far. But overall in Texas, you know, Texas has one of the worst rates of maternal morbidity and mortality. We are very excited that the postpartum Medicaid extension was made, but of course we are a state that does not have Medicaid expansion. What we're also concerned about from a workforce perspective is having enough physicians, right, for the population, and enough physicians that actually
that are doing a good job. Do you keep track of that? Because you think among 50 that someone
I can point to California, the California Perinatal Quality Collaborative. They've done some really great work, and especially when you think about that population. Also, New York is doing some really great work. I think, again, in collaboration with the MMRCs, the data piece is very important. That drives a lot of policy from a public health perspective and for hospitals.
More doctors and professionals paying attention to it, especially among minorities as well. We should be throwing everything in the kitchen sink at this, both federally and by state. I want to segue to one other issue that I bring up always, is the broken nature of our healthcare system that's increasingly being run by large corporate entities that I don't know that have any interest in prevention and wellness, mostly in expensive remediation. And until we get that fixed, we're going to keep, I think, avoiding what we all know makes more sense, prevention and wellness. And that's going to take a cultural change within healthcare itself. Probably the biggest thing would be, how do you lower costs among insurance companies and hospitals? I can tell you what's been happening has been the opposite. It's alienated even a lot of physicians and nurses from getting into the business, because their dream wasn't to be working for huge corporations that don't have practitioners in mind and the patient. That's got to change in terms of what we can do state by state and here as well. Senator Sanders and I introduced a bill, and it's already got a lot of bipartisan support. Senator Smith, Hickenlooper, Grassley, Coons, Hassan, Ernst, and Baldwin. And this would be transformational. It's a bill that's going to force corporate healthcare to accept transparency and competition, not to have barriers to entry for people to get into the healthcare business or try to corner the market with high costs along the way. So I would urge all of you to make sure in a grassroots way you get behind it. And until we break that grip to where that is in control, we're never going to address this or many other issues related to health care. Thank you for being here today.